Well, the popularity of alternative medicines is on the rise, but just how safe are they? A leading Australian forensic pathologist is warning of a whole host of adverse effects that can arise from their misuse, including death. That's a hell of an adverse effect.
Professor Roger Bayard wants to dispel the belief held by many that because they come from nature, alternative medicines are harmless. Let's break it down. Joining us now with more is Dr. Cindy Pan. Hi Cindy, how are you doing? What do you think about this belief that because they're natural, alternative medicines are safe?
Well, unfortunately, it's not true. I mean, obviously a toadstool can be poisonous and that's natural, and even, funnel web venom, I mean, it's still natural, but it's obviously poisonous. And I think it's a common misconception that because something is natural that it's safe, but also that it might be superior to something that was synthetic. And also there's a perception that prescription medications aren't natural, when in fact a lot of them are in fact derived from plants originally. It's just that now the way that they're produced is in a sort of purified and regulated way, so it doesn't look like a leaf or something like that anymore.
Now, if you're going to experience some of these adverse effects from taking alternative medicine, when is it likely to occur?
Well, there's a whole range of situations where it might occur, but particularly say if you're on other prescription medication where you might have a drug interaction, say infants and children might be a lot more vulnerable, or elderly people. I think in certain instances where, say for example, you're going to have surgery, or if you're pregnant or breastfeeding, those sorts of situations might be more of a risk. And obviously also if it's been prescribed by someone who's not medically trained or doesn't have a lot of experience, or if the preparation itself has been faulty.
Okay, we're talking about possibly bad things happening to you if you take some of this stuff. Give us some specific examples.
Well, one of the terrible instances that happened in 2006 was the young man in Adelaide who injected a herbal medicine called Chansu. I mean, it's supposed to be ingested in any case, but it's actually derived from toad venom, and it's sometimes used for sore throats by herbalists, but of course in this case it caused death. And then there are quite a lot of instances where, say, children have been given Tibetan herbal vitamins and things like that, which in fact were contaminated or contained lead. And there's an instance of a 5-year-old who actually ingested something like 63 grams of lead over 4 years from basically taking these vitamins. So kind of the irony of the parents thinking that they were doing their child a favour and kind of boosting their health, but in fact essentially poisoning the child.
Yeah.
So as you've said, it can be problematic to mix those alternative and the orthodox medicines, so the stuff you buy from the chemist with the goat's testicles, for instance. But who's going to give us this advice? Because the doctor's not going to advise you about the herbal stuff, is he?
Well, the problem is that often people resort to these herbal preparations and they don't necessarily tell their doctor about it, either because they fear that they'll be ridiculed or discouraged, and there's always going to be a problem when the right hand doesn't know what the left hand is doing. I think it's really, really important that if patients are interested in trialling or experimenting with these herbal remedies, that they at least tell their GP and any specialists that they're seeing what they're planning to do, so that if there is any potential drug interaction, or if there is any potential that it's going to increase their risk of hemorrhage or heart palpitations or whatever it is, that they're aware of that and can help them with it.
Okay, some good advice to take away. Thank you, Dr. Cindy Pan.
Thanks, Cindy. Still to come.